Bismillah ar-Rahman ar-Rahim. It is exactly 8:23 a.m. and this year World Diabetes Day is on the 14th of November, and the theme of World Diabetes Day is access to diabetes care. If not now, when? The message associated with this year's theme is to make sure that everyone has proper access to diabetes care and treatments. Sadly, experts are telling us that millions of people with diabetes around the world do not have access to diabetes care. So, to talk to us about the impact of this issue is Dr. Shameem Jamdullay. He is a senior research scientist at the UCT Lung Institute. Assalamu alaikum, welcome to the program.
Walaikum salam, and thanks again for having me.
Thank you for always being so very generous with your time. How serious is this issue, Dr. Shameem, in terms of people who aren't able to access the medication they need? What are the ramifications as far as their health and well-being is concerned?
So, what I need to highlight first is how diabetes disproportionately actually impacts on, like, again, lower income countries. We've always had a big focus on the infectious diseases, especially on the African continent, such as HIV, TB, malaria. But what, as I mentioned in my last appearance on your show, is that we've experienced an epidemiological transition where we are also seeing an increase in the non-communicable diseases. And the problem with diabetes is growing in South Africa. It is thought that 1 out of 7 or 1 out of 8 people in South Africa are actually diabetic, and that is around 3 times the same prevalence across the world, the global prevalence. So it highlights how urgent the issue is. And the problem also is that diabetes is a condition that actually leads to a deterioration of a lot of other health functions. For example, when you get diabetes and when you develop diabetes, you are at higher risk of cardiovascular diseases, you are at higher risk of renal failure that would require you to have dialysis. You are at greater risk of having an amputation because of the necrosis and the problem that it causes in the lower limbs. And there are so many other things that will make it such that it impacts on the well-being of the person, affects the daily life that the person would normally have. And the problem with diabetes now is touching more and more younger people. And you can imagine that the impact that it may have if it is somebody who is relatively young and who is the income earner in a family. And that has much more impact than just the person who actually suffers from the disease, but also people around that person.
But putting it simply, Dr. Shameem, it really is a lifestyle disease, or is it more than that? Are you predisposed due to genetics or other factors?
You know, it's an irony that you're speaking to me about not an irony, but rather like it's a coincidence that you're speaking to me about diabetes. And I actually come from a country. I'm from Mauritius. Mauritius was for a number of years the number one diabetes sufferer, the one country with the highest rate of diabetes in the world. And there are two different reasons that explain why we have a high level of diabetes among the population. The first one is lifestyle. And when I say lifestyle, it's out of choice. So, for example, where I come from, my country fortunately has one of the, if not right now, the best GDP per capita. So we count as one of the richest countries in Africa. And when we see people having and developing diabetes in countries like Mauritius, it's mostly because of a lifestyle issue out of choice, where people can have control of what they eat, but they decide to go for the sugar. Whereas in a country like South Africa, where you have like a greater level of poverty and a greater proportion of people who don't have a choice of what they eat, it is mostly driven by factors that make it such that we eat a diet that is not balanced. It is much more starchy. It has more sugar that is added to balance for probably a deficiency or lack of sufficient food. And that for me is the biggest factor. And you talked about the genetic factor. Diabetes as such is not a direct genetic, factor. It doesn't mean that if your mother or your father or anybody higher up in your family, say your grandpa or your grandma had diabetes, that you get it. What we know is that there is what we call an hereditary predisposition. So if you've had it in your family before, and if you don't control the way you live, what you eat, how much of it you eat, this is when you're actually exposed to developing diabetes. And we're talking about diabetes type 2 there, which is probably the diabetes that accounts for around 90 to 95% of all diabetes cases. And yes, in South Africa, it is a combination of one, a lack of access to proper food because of the poverty and the means that one has, but also a lot about the education. We need to educate people about, how bad it is, how much sugar, for example, there is in a soft drink, and what are the alternatives that could be as pleasurable to the mind, but with a lower impact on the body.
Okay, so my final question to you this morning, Dr. Shameem, is um, if people who are suffering from either type 1 or type 2 diabetes, very especially type 2, because it's directly linked to your lifestyle, the type of junk foods and too much sugars we eat, and lack of exercise, if they don't get the medication, what sort of, and I know that each case would be different depending on the other comorbidities that the patient is suffering from. But what sort of impact would this have on patients? Early death, perhaps?
Most definitely, because you also have acute events that can arise from not controlling your blood sugar level. The blood sugar level forms part of one of the most important aspects of what we call the physiology of the body. And if there's no balance in there, there is a high risk that there are adverse events that will happen. Obviously, many of the effects that people suffer from diabetes are long term, so they take time to develop, like your renal failure, your cardiovascular disease. But they are acute events where you can actually go into like a diabetic coma and many other events that can happen when you don't control your diabetes as such. And it's not just for people who have been diagnosed with diabetes, but we know that there is a high proportion of people, they are around 1 million people in South Africa who are pre-diabetic or very close to actually developing diabetes that are not aware of their status. And these people, we need to identify them and we need to educate them around the issue as fast as possible so that they can take the corrective measures in place. So when we talk about treatment, we also talk about access to diagnosis because if you don't get diagnosed with diabetes, you can't get treatment for diabetes. And the good thing about diabetes is that it doesn't require a big facility or a big machine, an expensive machine to actually be diagnosed. It is something that you can use a portable machine with a relatively like low cost, and do that, from the perspective of like primary healthcare access almost anywhere that you want to. So this is also something that we need to highlight. And unfortunately, with COVID, we've seen that this has decreased, and also the access of people to treatment has also decreased. So, as I said, the effects are multifold, and you do have short-term and long-term effects that are associated with not controlling your diabetes and not having access to treatment.
Dr. Shameem Jamdullay, Senior Research Scientist at the UCT Lung Institute. You're also trained medical virologist and epidemiologist. Thank you indeed for your insights into diabetes. Assalamu alaikum to you. And just a reminder to our listeners, World Diabetes Day is celebrated on November the 14th to mark the birth anniversary of Sir Frederick Banting, who discovered the insulin hormone along with Charles Herbert Best in the year 1922. According to researchers, over 430 million people globally suffer from diabetes. It is exactly 8:33.